Anxiety is a normal part of life, with most people experiencing it at some point. However, around 8 million people in the UK have some form of anxiety disorder, which can go undiagnosed for long periods of time. This can be due to the nature of the way in which anxiety, and particularly anxiety disorders, manifest themselves. Many symptoms of anxiety are extremely similar to other illnesses, with anxiety sometimes causing physical health problems as a result. Dr. Elena Tironi, a consultant psychologist and co-founder/co-CEO of My Online Therapy, and Terence Watts, psychotherapist and founder of the BWRT Institute, spoke with Express.co.uk to share insight into the signs and symptoms of anxiety. Symptoms of anxiety which can be mistaken for other health problems. While anxiety is largely a component of mental health, it can show physical symptoms that could confuse some sufferers. Dr. Tironi explained, any physical symptoms of anxiety, such as palpitations, difficulty breathing, nausea or chest or stomach pain, can be mistaken for physical health issues. These might include cardiac problems, respiratory issues or gastrointestinal conditions. But this can happen the other way around too. Some physical health problems may present as anxiety. So, if you're worried about any physical symptoms, it's good to consult a GP. According to Mr. Watts, chest pains are one of the common symptoms that can drive people to the hospital with a suspected heart attack. However, he pointed out there have also some rather unexpected symptoms which therapists have encountered over the years. He explained, others can be baffling and defy all medical diagnoses, which is when it is assumed that anxiety is at the root of it. Chief among these is conversion disorder, which can result in temporary blindness or double vision, partial paralysis commonly of the legs, pseudo-seizures that can mimic epilepsy, loss of voice or problems with speech, memory issues that can mimic early signs of dementia and stroke symptoms. Anxiety symptoms can be particularly confusing, and sometimes scary, for those who have never suffered from it before. Dr. Tironi said, the physical symptoms of a panic attack might feel so overwhelming that someone genuinely thinks they're going to die. Especially if it's something that hasn't happened to them before, and they don't recognize what it is. Mr. Watts added, often anxiety itself can be the reason sufferers might think their symptoms are an indication of a worrying physical medical condition. He explained, the human brain is disposed to think and fear the worst, a trait inherited from our ancient ancestors. In those days, assuming something might kill you was more likely to lead to survival than assuming it would not. This is the exact reason why bad news makes more lasting impact than good news, the predisposition to focus on the bad news so that we might be able to find a way to avoid the outcome. The most common symptoms of anxiety. There are some symptoms, both physical and mental, that are most commonly associated with anxiety. Mr. Watts says the condition has a wider range of symptoms than just about any other condition. However, some of the most typical signs associated include brain fog and memory issues, racing thoughts, difficulty breathing, hyperventilation or shortness of breath, racing pulse or palpitations, a feeling of butterflies in the stomach, weakness or tingling in the arms and legs. Dr. Tironi added, anxiety attacks are normally triggered by something specific, and typically happen after a period of excessive worry, whereas panic attacks come out of the blue, and the symptoms tend to be more severe. Some of the lesser-known symptoms of a panic attack might include feeling numb, dissociation or feeling out of body, nausea and stomach pain. What is happening where you live? Find out by adding your postcode or visit in your area. What should I do if I think I might be suffering from anxiety? Both experts urge people who are struggling with anxiety to seek help. Dr. Tironi said, "Remember, it's okay to ask for help." In a similar vein, Mr. Watts said anxiety is not weird but in fact a rather normal aspect of life. However, for more severe anxiety disorders, any symptoms are worth a visit to the doctor. Mr. Watts explained, "If you know exactly why you're anxious and understand it, then you can use any of the techniques above to relieve it. Otherwise, if you have a symptom you don't understand, it's always best to err on the side of caution, rather than assume that it's just anxiety." It's easy to assume that a mild symptom is nothing more than anxiety, but there's no foolproof way of finding out other than by medical investigation. This is even true if you just feel anxious but don't know why, since that can often be a sign of physical illness that is as yet not producing other symptoms. It can be caught early. There are a variety of methods of help for anxiety available, including cognitive behavioral therapy and brain working recursive therapy, BWRT. Dr. Tironi explained, "If your anxiety is spiraling out of control, therapy can be very helpful. In your session, a psychologist will help you figure out the root cause of your anxiety, identify any triggers and teach you coping skills and techniques to help diffuse and manage your worries."